Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of February 28th, 2022. Today I'm going to talk about two new developments from the CDC. Each of them on their own give me pause, but when you take them together, they are bringing me some concern. Those are the CDC's new mask guidance, as well as new data regarding the shortened 5-day isolation period. But first, I will provide a brief status update, including on Alameda County and Oakland. As health professionals rooted in Oakland, we are serving some of the people most vulnerable to getting and suffering from COVID-19. So we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. By way of national updates, we've been seeing cases coming down overall, hospitalizations coming down. I think for the first time this week, I can confidently say that we are seeing deaths coming down as well, although they are still tragically high. We are losing just under 2,000 people per day to SARS-CoV-2 infection. And this is coming down certainly, but it's still incredibly and tragically high. And also with our pediatrics, with our children, we are continuing to lose children. We have lost 20 more children since I reported last week, and it was 20 the week before. We're losing children, unfortunately, although the numbers may seem small compared to adults. We don't compare these things to adults because these are children, and we are unfortunately doing worse with the pediatric age group now than we were in earlier parts of the pandemic, despite having a vaccine at least for 5 and up. We are losing about 3 children per day. Since the beginning of 2022, we've lost more than 150 children in the United States, and over 150. And for the same time period, for your reference, we have had 1 pediatric death from the flu. Here in Alameda County, looking at our 14-day cases, you can see that we are continuing to come down. We're still kind of just a little below where we were at our summertime peak. And we definitely are now, what we're going to be looking for is really coming back down to a much lower baseline. So we've still got a fair amount of SARS-CoV-2 swirling around in our environment. And we are going to want to see this really come back down to a baseline rather than doing any plateauing. So we're going to be keeping a close eye on that. In terms of hospitalizations, continuing to come down pretty nicely here. We're at 134 people in the hospital, 31 of those in the ICU. We have 1,734 people who have lost their lives here in Alameda County to COVID-19. That's up 21 from when I reported last week, and 7 of those being here in the city of Oakland. And this has been pretty consistent here in terms of the difference in deaths between those who are not vaccinated and those who are. This is from the state of California. This is showing the week ending January 30th, and it is pretty consistent. We're seeing that those who are not vaccinated are 16 times more likely to die from COVID-19 than those who've received a booster. And we know that, and we can see here with those bottom 2 lines, that even though these both look low, it is less than half of the risk of dying if you're boosted compared to just fully vaccinated, but certainly providing protection from the most severe outcome of SARS-CoV-2, whereas those who are unvaccinated, really at this time, these are the people that we are primarily losing to COVID-19. So what has the CDC done in terms of their mask guidance? So they completely changed around how they're doing it. And overnight, just like that, we went from this map, which is kind of bright red everywhere, showing high transmission pretty much all across the country. Overnight, we flipped to this map, which is, well, there's no more bright red. I guess we're working in pastels now. But clearly what has changed is not the level of COVID, but rather how the CDC is going to decide to talk about it and categorize it. And I'll be the first to say that we have been asking over the past weeks, well, what metrics should we be looking at? Because we have such a moving target here with the new variant that's so highly transmissible, that what is it that we should be looking at in terms of metrics? So the new metrics are actually based on a few categories, and those are new COVID hospitalizations, hospital capacity, and then new COVID-19 cases. And so, based upon this new scoring rubric here, about 70% of the population is in a location that is not considered high transmission. So, it's being considered low or medium risk here, based upon these new criteria that have been set. And I can tell you that I have a few concerns, and one of them is that, as we've talked about for a couple years almost now, hospitalizations are really a lagging indicator. So by the time we have new COVID-19 hospitalizations, we're already late to be trying to put in place something like masks, which are really meant to prevent us getting to that point in the first place. So the fact of using COVID-19 hospitalizations as an indicator of whether we need to mask seems a little too late. Hospital capacity. I think it's good that we are monitoring hospital capacity as a nation. I will just start with that because I don't know that we were necessarily, I don't know that we had a reason to do it before, but clearly we have a reason to do it now because, as we saw and experienced, most of us for the first time in our lives, that our hospitals could be overwhelmed and they could exceed capacity. And then that means that people, even who don't have COVID-19, may die or have a poor outcome just because they couldn't get a hospital bed. And so it's important that we look at hospital capacity. However, using hospital capacity as a metric to decide whether we should be doing a public health intervention like masking also to me seems problematic. We are here in the Bay Area. We've been very fortunate. We have not had a situation where we were not able to accommodate people in our hospitals. And I am very grateful and feel very blessed for that fact. But does that mean that I want to tolerate more people dying from SARS-CoV-2 or more people catching it and doing poorly with it because we have better hospital capacity? For me, these don't add up and they don't really make me feel that comforted, because essentially hospital capacity is a measure of a number of different things, but not necessarily a measure of whether we are doing okay with COVID and whether we need to be worried about COVID. So, new COVID-19 cases, we know that that is not a perfect metric, especially now that people are testing within their home and so on. But having said that, I think it is at least important that we continue to look at the direction that the cases are going. Are they going up? Are they going down? So, all of that being said, even though the map dramatically looks different, I don't think that this is necessarily going to be the indicator that you will want to use necessarily to decide whether you should be wearing a mask or not. We need to be taking a lot of different things into consideration. And the reason why, in particular, that I am concerned about this change is not to say that I think we need to have mask restrictions forever. It's not even to say that these are the right or wrong metrics, but it is to say this. Here is where I think we are with COVID-19. We have no treatment for anyone under 12 years old on an outpatient basis. We have no vaccine for anyone under 5-year-old. We know that people who live in lower income neighborhoods, low wage workers, students who are in schools in lower income areas have higher rates of exposure just based on crowding, using public transportation, living in high density housing, being in schools that don't have as good a ventilation or infrastructure. So these are the people that will be experiencing higher exposures. And I have talked so many times and showed you so many maps of Oakland and Alameda County, and it is the same zip codes that we've been concerned about all along 94603, 94605, 94578 in Hayward, 94601 in the Fruitvale. These are the zip codes that have suffered with a high burden of cases and right now are still seeing lower rates of vaccination. So, in other words, there is uneven exposure. So we've got no treatment for under 12, no vaccine for under 5, higher exposure rate for many of our communities. We have uneven vaccine and booster uptake. This is not only the case for the zip codes in the areas I just mentioned, but really um, all over the country and worldwide, we have very uneven distribution of the vaccine and booster uptake. So, are we really ready to remove one measure that is helpful whether or not people are vaccinated or boosted, and that is a mask? And these last two are incredibly important. At least for me, they're incredibly important. Is that we have unequal access to pre-exposure prophylaxis. I talked about Evusheld in great detail in last week's briefing. So if you or someone that you care about is immunocompromised, please take a look at that. But there is a treatment that can protect you for 6 months if you may be somebody who did not mount a good response to the vaccine. But unfortunately, we do not have good access of this across the country. We are very fortunate that we have good access here in Alameda County. I've invited our friends from Total Infusion on the briefing before, and they have Evusheld. So we have it right here in East Oakland. You are able to get it. I want to make sure everybody knows about it. If you know anyone who is on chemotherapy, on high dose steroids, who has a compromised immune system, who may not have mounted a good response to the vaccine, let us please find out if they are eligible for Evusheld and let's get them in for treatment. Unequal access to treatment, and this is again for people who are high risk. If you are someone who is high risk, and the link is in the post to all the different conditions that right now are considered high risk. This includes so many people in the United States. This includes former smokers, it includes people with diabetes, it includes people who are overweight. So if you are high risk and you would potentially benefit from treatment, we need to make sure you have access to it. But the fact of the matter is that we do not have equal access to treatment here in the United States at all. So I'm saying all of this to say that at the point when we have a treatment for under 12 and we have a vaccine for under 5, and where we have more even risk of catching SARS-CoV-2, a more even vaccination and booster uptake, and where we have adequate access to both prophylaxis and to treatment, then maybe we would feel more comfortable about a blanket lifting of a mask mandate. But until that time, we can be sure that we are putting certain groups at higher risk than others. And what does that mean? That means that the disparities that are already quite shameful in this country that we are experiencing, those disparities will only get worse from here. And so, for that reason, I think it is really important that each of us take a look at our individual situation and we ensure that we have access to what we might need to do better if we catch it, or to prevent ourselves from catching it, or to give ourselves prophylaxis before we catch it so that we do better. Any of those things we need to be thinking about for ourselves before we go ahead and engage in activities that may bring us harm. So just because these protections have now been lifted does not mean that anyone is saying that this is appropriate for anyone and everyone to just go without a mask in a crowded indoor environment. And quite the contrary, what it is saying is that the decision is now left up to you, and you are going to have to base it upon your own risk factors. The other thing that came out of the CDC on February 25th, in the Morbidity and Mortality Weekly Report, on the February 25th Morbidity and Mortality Weekly Report, I put the link in the post, and this was talking about the shortened isolation period. So we know that the isolation period used to be 10 days. It got shortened to 5 days. With Omicron, we know that that was, in my opinion, and I mentioned this before, this was not a disease transmission reason. This was about making sure that we had an adequate workforce so that things didn't come to a grinding halt. So we essentially assume that it's possible that we may be sending people out of isolation when they were still contagious. But for whatever reason, CDC chose not to recommend a test after those 5 days and just kind of left it up to the individual, but really only required 5 days of isolation. And we know that in practical terms, what that meant is that the schools were saying, we want Susie back in the seat day 6, or the boss was saying, we need you back down at the workplace on day 6 because it's only 5 days, when we know for sure, first of all, a lot of people are not feeling better after 5 days. Second of all, a lot of people are still contagious after 5 days. And the study that they published in the MMWR showed that. So, what it showed was that out of 729 individuals evaluated, 54.3% had a positive antigen test result. Over half were still positive. Remember, the antigen test is the one that is checking the burden of the viral load inside of your nose, essentially. So, still contagious, basically. And so, if you are still positive with the antigen test, you are most likely still contagious. And over half of the individuals were still contagious after day 5. So this is very concerning because the CDC didn't take this and say, oh, maybe we should change the guidance. Maybe we should make it 7 days, or maybe we should make it so that you need a test in order to come out of isolation, which is what we are recommending. Instead, it just said, well, during the 10 days, you might still be infectious to others and you should just wear a mask. Doesn't even specify which mask. And we know that the best mask to wear, period, is a high filtration N95 mask, but especially if you're still contagious. So this guidance is concerning, where the same time that you're lifting mask mandates, turning the whole country into a yellow or a green or peachy color that says it's okay to take the masks off, and you're still saying it's okay to come out of isolation after 5 days, even though we think you might have more than 50% chance of still being contagious. All of this is adding up to a really concerning picture for me that makes me worried that we won't come down as nicely as we want to that baseline or a very low level that we're going to unfortunately maybe, well, I worry that we will plateau too soon and then we'll start heading back up in our summertime surge. And that's really what we don't want to see. And so the CDC ends the MMWR report by saying antigen tests might be a useful tool. You think? So please just get some rapid tests, have them at home. We have them at Roots. Many community health centers should have them to give away. They should be available if you have healthcare coverage. It sounds like a few steps you have to go through, but you can get reimbursed for them. So let's stock up. Let's use this time to please stock up on some antigen tests. And after you have tested positive and you're in that day 6 through day 10, how about we get a negative antigen test before leaving isolation? The CDC isn't coming out and saying it, but it really needs to be said. If you are going to still choose to go out and about, please wear an N95. Again, CDC is not coming out and say it. I disagree with that. We need to be saying N95 after 5 days and antigen test to get out of isolation. And we need to be saying that in most cases, it is still going to be the safest thing to do to wear a high quality, high filtration mask when you are in an indoor setting. And I want to point out and give some credit to the president of the American Medical Association. His name is Gerald Harmon, MD. He is a family medicine physician like myself. And for whatever reason, the AMA president gets no airtime. I've seen no headlines about this. I've seen no media about this. I guess it's an unpopular opinion at a time when the CDC has come out and done what it has done. But what the AMA president has said, and I'll quote here, is that he's going to continue to wear a mask because, quote, millions of people in the United States are immunocompromised, more susceptible to severe COVID outcomes, or still too young to be eligible for the vaccine. So essentially saying that there are people who are vulnerable and that wearing a mask, I'm paraphrasing now, isn't that big of an inconvenience. It's not that hard. And given that millions of people in the United States are immune compromised, are more susceptible to severe COVID outcomes, or still too young to be eligible for the vaccine, that he himself is going to continue to wear a mask. So I think we need to be watching what folks are actually doing, listening to hear what people are doing, and not necessarily these blanket guidelines that may be coming out because of pressure from different sectors, different areas, and not necessarily based upon COVID-19 transmission itself. And remember, until we have treatment for everyone, equal access for everyone, then we need to be really cautious that our actions are not going to exacerbate disparities that are already bad enough. And so being tired, being frustrated with this does not equal being done with this. And a new guideline that changes the map from bright red to pastels does not mean we're done with this. And so, really, the guidance remains the same. To prevent the most severe and tragic outcomes, vaccination and booster are still incredibly effective. They are safe, and they are allowing us to survive even in the event that we do catch SARS-CoV-2. Also, if you don't have a primary care physician, please get one. This is the difference between you being able to access life-saving treatment or you not getting access in time, because remember, they require treatment within 5 days of symptoms onset for the pills and within 10 days of symptoms onset for the infusion treatment with monoclonal antibody. But the only person who is going to prescribe these things for you is your physician. So if you get a test at home and then think, I'm going to go get treatment, well, if you don't have a doctor, think again. So please get a doctor now before you need to be scrambling for one. Make sure you know how to reach them before you need them. Remember to eat a balanced diet, get some exercise, manage your stress, take a multivitamin supplement, consider some extra vitamin D supplementation, and get a good night's sleep. Remember, a high filtration mask indoors is much better than cloth or surgical. Outdoors is always going to be safer than indoors. Farther away is safer than closer together, and a shorter time together is much safer than a longer period of time when you are indoors with people who are not in your bubble. This concludes today's People's Health Briefing. Thank you so much for joining us. We'll see you again next Tuesday at 10 a.m. See you then.